Assalamualaikum and hello. I am Tun Yasmin Iffah and the title for today's presentation is Perceived Acceptance of Service Quality and Physical Accessibility by Caregivers of Children with Special Healthcare Needs Attending Special Care Dentistry Specialist Clinic UiTM, a preliminary study. In this presentation, we will talk about background of study, objective of the study, the methodology, and the result and conclusion of the study. WHO has defined disability as an umbrella term that covers impairments, activity limitations, and participation restrictions of a person. It was also reported by WHO that persons with special healthcare needs have unmet dental health. There is a significant increase in number of registered children with disability in Malaysia from year 2016 to 2019. Rosa et al. And Lewis et al. Reported that children with special healthcare needs often exhibit poor oral hygiene with unmet dental health care needs. Individuals with special healthcare needs also have higher risk to develop oral diseases throughout their lifetime. However, it was noted that the unmet dental health needs are due to barriers faced by both the caregivers of the patients and the practitioners. Financial barriers, limited accessibility, as well as lack of awareness and motivation among caregivers are the barriers faced by the caregivers. As for the practitioners, several studies claim that limited facility and accessibility, poor developmental and structural planning, and inadequate training in management of patients with special healthcare needs are the barrier faced by the practitioners. Hence, referral to specialist clinic is often given for management of patients with special healthcare needs. A study by Hamza, 2012, mentioned that there should be a research to investigate the quality of service provided. This is in line with Chang, 2013, where identifying patient satisfaction and improving healthcare service quality have become crucial for health centers' operation. The importance of doing so is because good communication, empathy, and satisfaction towards the treatment provided will increase compliance by the patients. Objective of the study is to investigate the caregiver's perception of services, quality, and physical accessibility provided by the Special Care Dentistry Specialist Clinic UiTM, as well as their future expectations. The study is a cross-sectional study. The instrument used is a bilingual modified validated serve-call questionnaire. The inclusion criteria for this study is caregivers who live in the same house with patients with special healthcare needs, who understands and able to read English and or Malay, and who is able to give consent for participation. As for methodology, the serve-call questionnaire was adapted, translated, and validated. Then, the modified questionnaire was distributed to the caregivers of patients attended Special Care Dentistry Specialist Clinic, UiTM, by Google Form, and then the data analysis was done. Now, let's take a look at the instruments used in this research. This is the modified serve-call questionnaire. It is a questionnaire consisting of 6 domains with 28 questions in total. The domains assessed in this study are tangibles, reliability, responsiveness, assurance, empathy, and physical accessibility. The link attached is the Google Form link given to the caregivers in both Malay and English language. Data entry was done using Microsoft Excel and analyzed using SPSS software version 27. Reliability analysis, that is Cronbach's alpha, frequency and correlation analysis was done with p-value below 0.05 is considered significant. Reliability analysis was done on all 6 domains of the questionnaire. All 6 items shows value of more than 0.6. Hence, we can conclude that all items in modified serve-call questionnaire have strong reliability when given to our current demographic. As for the frequency, for the diagnosis, the highest number of percentage is children diagnosed with autism, Down syndrome, and dyslexia respectively. 78.3% of respondents are from Selangor, and we can safely say that the mothers are more involved in participation of the study. The highest number of caregivers participated in this study are from income group of between 4,850 to 10,959 ringgit at 37%. And as for years of experience of taking care of children with special healthcare needs, 65.2% are of parents who have been taking care of children with special healthcare needs in less than 10 years. As for the correlation result, there is significant findings found between caregivers of patients diagnosed with learning impairment and an item intangibles as well as assurance. Question 3 intangibles is regarding the way the dentist and staff dresses, and question 4 in assurance is the knowledge of the dentist and the staff to answer the questions by the patient and caregivers. As a conclusion, caregivers of children with learning impairments acknowledge that the Special Care Dentistry Specialist Clinic UiTM is well equipped. Sufficient physical accessibility with its staff shows great assurance, empathy, and reliability in providing comfortable dental visit. However, there is a suggestion for refinement concerning the clinic's operating hours and to redecorate the clinic to make it more comforting for the patients. Here are the list of the references. With this, I end my presentation. Thank you and have a good day.